COVID cases are soaring, but the course of England's outbreak is changing too. In northern cities, numbers are rising fastest, bringing a threat to the health system we haven't seen since March.
This virus is so infectious that once it takes hold in a community, there will be clusters that will occur. And those clusters quickly spread, and they're associated with urban areas in particular, particular types of housing, high numbers of key workers. That's what you're seeing in the northwest, the northeast, etc. It's predictable, but it's also very, very concerning.
The latest research suggests that for every 100,000 people in England, 600 currently have the virus. But the infections are far higher in the north, where the rates are up to 1,000, in stark contrast to the rest of England, where levels are still far lower. And the rate of growth varies too. Cases in England as a whole are doubling every 29 days, but in around half that time in much of the North and Midlands.
We're taking on all of the cases around schools.
It's becoming a tale of two outbreaks, posing an unenviable challenge for government. The threat of a lockdown lottery where the virus decides the odds. It's something that worries local public health bosses.
I don't believe that we can enforce our way out of this. And actually, the idea of imposing further restrictions when we've had 3 weeks of quite confusing messaging for our residents, I think will present problems. That said, if we continue to rise in the way that we're rising, then I absolutely see that it will be necessary to have further restrictions in the very near future.
The outbreak isn't just split geographically, but generationally too. And with worrying signs, the virus is working its way towards the more vulnerable. By far and away, the most positive tests were among those aged 18 to 24, more than 1 in 10 of all those tested. And while far lower, infections among those aged over 65 increased 8-fold in just over 2 weeks. While the north stands out, infection rates are rising in most parts of the country with urban hotspots. Nottingham in the East Midlands currently has the highest weekly infection rate in the country. That leaves Emily Leary, whose daughter has a respiratory condition, concerned about school and the winter months ahead.
I wasn't worried until the most recent set of stats came out, because it's risen so quickly in the Nottingham area that it's gone from being, oh yeah, it's rising, but we've got the students back, to actually this is really scary. And although obviously we weren't testing to the same degree back in March, you know, statistically, this is the most prevalent it's been in Nottingham. So that's, yeah, I'm pretty worried as of the last couple of days.
A 3-tiered lockdown system is expected to be introduced next week. It seems inevitable it will fall along a north-south divide, but there's nothing in the statistics to say it'll stay that way for long.